Good afternoon. My name is Chang. In years past, I've had the honor of speaking on behalf of the Delaware Cancer Support Community Center about skin cancer awareness during the month of May. Because of the state restrictions during our current pandemic, we will be taping this year's talk to be placed on their website for your own viewing. The focus of today's talk is on preventing skin cancer. Let's begin by talking about skin cancer and how it affects so many of us. Here are some facts. Fact number one, skin cancer is by far the most common cancer in the United States today, with 5.4 million new cases of non-melanoma skin cancer reported every year, which makes up about 3/4 of all newly diagnosed cancers. Fact number two, by the age of 70, 1 out of 5 Americans will develop a skin cancer. However, only about 2,000 Americans will die each year because the vast majority of skin cancer are detected and removed before they have a chance to spread. Fact number three, basal cell and squamous cell carcinomas make up the vast majority of all skin cancers. Fortunately, they're very easy to surgically remove. And fact number four, melanomas have the ability to readily metastasize, and unlike most cancers, can spread anywhere in the body. Yet, melanoma is listed as the 4th most survivable cancer. And because melanomas are exposed on the skin, we have the opportunity to see them and catch most of them early on before they have a chance to spread. And if diagnosed early before they metastasize, which is approximately 84% of the time, melanoma can be cured surgically with up to a 98% 5-year survival. And as a lead-in for today's talk, I would actually like to introduce you to Mary Bruno. She's the VP for Moving for Melanoma, a Delaware nonprofit that raises funds for melanoma awareness, support, and research. Thank you.
Thank you. So I'd like to thank Dr. Chang for inviting me here today, and I'd like to thank the cancer support community for creating this event. We're calling it the Skin Cancer Awareness Event. And thank you to all of you for viewing today and for being here and caring about melanoma and its impact on our communities. My name is Mary Bruno, and I'm a lifelong fitness professional with the YMCA and the cancer support community. I teach exercise classes for them. I'm also the Vice President of Moving for Melanoma of Delaware, and we are a nonprofit that raises funds for research, awareness, and education about skin cancer and melanoma. My connection to melanoma goes back to 2000, when I had an in situ removed from my leg. I also had a wide excision to get all of the cells out, and then there was never a problem after that. Then in 2009, my son died at the age of 25. He presented with a flu-like symptoms for about a month. We finally had to go in to get blood work. He had a very high calcium level, which meant that whatever was happening, his bones were actually deteriorating because of the melanoma in the bones. He was admitted that day, and they still didn't know what was wrong with him. Even doing a visual check, they saw a mole in his back, but they didn't address it as the problem. Finally, they did a biopsy of the lymph nodes, and they found melanoma in the lymph nodes. And then on day 5 in the hospital, he just went on a chemotherapy drug, and he died 5 days later. It was in every bone and most major organs, and it started from a mole onto the back that he said was itchy. That's the only thing that he knew was itchy. The drug he received was 25 years old with only a 10% chance of survival. Today, we have many drugs for stage 4 melanoma. The most recent are called immunotherapy drugs. But how does one move on from something like this? So my husband and I looked for a vehicle to help educate and bring awareness and help to pay for research. We found that vehicle in Moving for Melanoma. It was an organization that was just 2 years old at that time, and it was started by Anna Marie Farrow and another melanoma patient who were going through treatment And they found the same frustration that we had, the lack of research about melanoma, especially in the later stages, and the lack of awareness and prevention, we found. So since 2008, Moving for Melanoma has raised almost $1 million in research. We give our money to the melanoma clinics at Penn, Johns Hopkins, and the Helen Graham Cancer Center here in Delaware. We've also gifted the cancer support community with money to help them support their programs. Our signature event is a 5K walk-a-run in September. This year will be a virtual event, so everybody can do this. Just get on our website and you can all be part of our event this year. We raise funds for research, but it also gives people a chance for their families to walk in honor of the loved ones that they've lost. And it gives survivors a chance to have a team at the event that would walk also in their honor, and to raise funds to help find a cure for the future. We do skin cancer awareness events, handing out information and sunscreen throughout the state of Delaware. Senior centers, YMCAs, schools, churches, swimming pools, and we try to do skin education, and we give out free sunscreen because we think prevention is really the way to go. If anyone's interested in more information, our website is delawaremelanoma.org, or on Facebook, we're at Moving for Melanoma of Delaware. I will leave Dr. Chang some brochures, if you would like any brochures about the program, and we'll try to get them to the cancer support community offices too. I hope my story and this program will make people aware of the dangers of skin cancer and melanoma. Dr. Chang's slides will show you what skin cancer would first look like, and also how to protect yourself from the sun. If you would like a skin cancer presentation with any of your groups, you can contact us on our website. I'd like everybody to stay safe and in the sun and take care. Thank you.
Thank you, Mary. That was very informative. We'll move on to the rest of our presentation. So for myself as a plastic surgeon, my interest in skin cancer goes back to my surgical residency training days, where I myself had a dark mole on my chest I was biopsied. That was a dysplastic nevus. It wasn't melanoma, but I was told that a dysplastic nevus was an abnormal mole that had a higher chance of turning to melanoma. And from then on, I was much more conscious about avoiding excess sun exposure and would self-monitor for any suspicious spots. And now, as I've built my career around the field of plastic surgery, I've really honed my skills around cosmetic, reconstructive, and dermatologic surgery. On the skin health side, I've spent years treating skin cancers by removing them, closing complex wounds both on the face and on the complicated areas of the body. Today, my skin health passion is focused on comprehensive skin cancer care, which starts with prevention, early detection and skin screenings, and timely treatment, which forms the basis of our skin cancer centers that I've developed throughout the Delaware and Delaware Valley region. All right, let's move on. So today's topics, we really wanted to understand about preventing skin cancer. First of all, we want to understand what are the most common skin cancers we see, and we want to identify which part of our population is at risk for skin cancer. Because once we define these people at risk, we can go on to doing things for early detection, biopsying, and hopefully eventually treating these skin cancers. And I'll go back at the end, talk about the importance of preventing skin cancer. So types of skin cancers. First of all, skin cancer, like a lot of cancers, is an abnormal growth, an abnormal uncontrolled growth of skin cells. It most often develops on areas of the skin that are exposed to the sun's rays. Skin cancer affects people of all colors and races, although those with white, light skin who sunburn easily will have a higher risk. So the three most common types of skin cancer would be basal cell carcinoma, squamous cell carcinoma, which are more treatable, better prognosis, followed by melanoma, which is less common, but has a higher chance of metastasizing. Basal cell carcinoma actually is now up to over 4 million new cases reported every year, followed by squamous cell carcinoma, which is now up to over 1 million reported cases every year. And melanoma is now up to 200,000 cases per year. So which of these melanomas, just by looking at these, would you think is most likely to be life-threatening? Once we make a decision on a body scan, an area we're concerned, to do a biopsy, the most important thing about the biopsy, is to determine if it's skin cancer, and if it is melanoma, we are really looking for the depth, the thickness of the melanoma, because it's the depth and thickness of melanoma that determines the chance of spread. So on the far left, you can sort of see these are where these cells have just entered just the top layer of the skin called the epidermis. That's a stage 0. There's no spreading there. The next one is a stage 1, just barely penetrates at the top layer. These are the ones we want to catch. These are the ones usually about up to 84% of the time we can find them early on, treat them, and they have up to a 98% 5-year survival. On the far right, you see the deeper stage 4s, which are much deeper. You can sort of see they go down deeper, which have a better chance of getting to the blood vessels and lymphatics that can potentially spread throughout the body. So, most effective treatment, skin cancer, particularly melanoma, is early detection. You want to remove the cancer before it has a chance to spread out from the skin. Let's talk about risk of skin cancer. We need to understand who's at risk, because these are the people that we can either screen early, we can also protect as well. So which of these skin types do you think is at greatest risk for melanoma? Fair light skin, blue eyes, reddish hair. Less protection from the adverse rays of the sun that potentially will cause skin cancer growth. Who is more likely to develop melanoma between these two people? People that have multiple moles, abnormal moles on their bodies will have up to a 12-time increased risk of having melanoma. Is the risk for melanoma higher if someone in your family, close, first-degree relative, has had melanoma? True. Again, a first-degree relative who has had melanoma, you are at an 8-fold increased risk up to for having melanoma yourself. 11% of people diagnosed with melanoma will have a second melanoma diagnosed within the next 5 years. And the risk for second melanoma remains elevated more than 20 years after the initial diagnosis. A blistering sunburn during your childhood will increase your risk of melanoma up to 3-fold. People who spend a lot of time in the sun throughout the years will have a picture like this across their back, lots of brown spots, that is indicative of chronic sun exposure. They will be at high risk for melanoma. So in summary, people that are higher risk for skin cancer, if you have lighter skin complexion, multiple moles, irregular moles, some in your family, or if you had a personal history of melanoma, and you've got a history of long-term chronic sun exposure. Once we've identified who is at risk for skin cancer, we need to go about how to detect skin cancer. And if we define the risk factors and detect them early, it leads to earlier treatment. Basal and squamous cell carcinoma. These are the most common skin cancers that we'll see. These are pink spots that people come to our clinic saying they got a little bump, a little wart, a little pimple. It just doesn't go away. It keeps coming back. It's irritating, it itches, bleeds sometimes. On this person's body, which of these spots would be a melanoma? Again, what you're looking for is that ugly duckling, that dark spot. So when you're talking about melanoma, you want to talk about the ABCDEs of melanoma. A for asymmetry, B for borders, C for colors, D is diameter, which is the size, E for evolving or a changing mole. For asymmetry, you can sort of see this particular mole, the shape is not round. It's a very asymmetric shape. The borders, if you look at this one, the borders are irregular and they're faded. There's no clear, distinct border. Colors, melanomas are pigmented, dark brown, black, but the ones that are suggested is where the colors are irregular. You can sort of see lots of dark spots mixed in with the lighter brown spots. Large size pigmented lesions are suggestive of melanomas. However, again, I've seen very small size melanomas, which can be very dangerous as far as spreading. On the other hand, I've seen very large size moles that are melanomas that don't spread. So again, but when you see a large lesion like this, especially when it's elevated, very dark and irregular, it's very concerning. As I said, melanomas can be very small, such as this one. And that's why sometimes we have to use a magnifying glass a little closer, but you can sort of see the irregular colors. These are some patients of mine through our clinic. The first one is a 67-year-old woman. She had never had previous skin cancer. There's a spot on her back. And again, it's a pretty typical melanoma. Again, you can sort of see the irregular borders. It's asymmetric shape. The abnormal colors throughout. This one is a little different. Similar age woman, again, no previous skin cancer. She actually just came for a routine screening because she's been in the sun a lot. You can sort of see just the background of all those little brown spots. But if you look carefully in the middle, there is some irregularity in that. Not very obvious compared to the other ones. These are the ones we really want to find in our centers. These are the ones we can screen, and with an experienced eye, we can pick these out fairly early on and catch them at a stage 0. We talked about catching them at stage 0, stage 1. Our survival rate is much, much higher, and the cure rate is very high. So what happens when you have so many moles in your body and they have all the ABCDs? I mean, what do you do at this point? You want to look for the evolving ugly duckling, the one area that just stands out. Now, this one's pretty obvious. So, again, we're going to talk about what more can you do for patients with lots of abnormal moles. Total body photography. We offer this in our office, on our screenings, particularly on patients that are high risk, where we found that 88% of melanomas are usually detected by either the patients or their partners. It's very important, monthly self-exams if you're at high risk. Look at yourself. And the one thing, now with the advent of our technology, hopefully most people have an iPhone or some type of device, is if there's a spot that you're concerned about and you're at risk, take a picture of it. There are some apps on your cell phones that you can do a side-by-side comparison so that once a month you can check it, but keep that on records. If there's any concern, it's better to soon to see a physician to take a look at these areas. But again, and also finally, you want to come in for your annual skin exams by your physician too. So again, what you want to do as far as detection, you really want to know what you're looking for. The ABCDEs of melanoma, looking for the ugly duckling moles. You want to look for newer changing dark spots. Examine your own skin monthly. Maybe use your iPhone quarterly, and come and see your physician. Examine your skin at least once per year. The aspect of preventing skin cancer really comes to prevention. And really the main cause of skin cancer is the sun. So protecting your skin from the sun is the best strategy to help prevent melanoma and other skin cancers. The sun rays at midday have the least distance to travel through the atmosphere. And so therefore, that is that time period where the sun rays are most damaging. Therefore, it's best to avoid direct sun exposure from 10 a.m. and 2 p.m. as far as unprotected sun exposure. Sun protected clothing, UPF or SPF rating, where clothing is better than sunscreen, and how to guarantee adequate sun protection for a young sports person. So, depending on the type of clothing, sun protected clothing, the level of protection can vary from 30 for a t-shirt to UPF rating of 300 for a club shirt. This type of protection is higher than what can be attained by sun creams and does not change over time. Sun protected clothing, how's it work? Based on the construction, dense type construction, more effective. Certain dyes can deflect or reflect more UV radiation. There's some that are treated with UV absorbing chemicals applied to the clothing, and certain fiber types, polyester, nylon, woven type materials, are much more effective as sun protective clothing. Most of us do not apply adequate amounts of sunscreen. It's very important to use large amounts of sunscreen. Broad spectrum refers to combined UVA and UVB protection. UVA are more longer wavelength sun rays that tend to penetrate through the skin deeper. They're the ones actually that cause wrinkles, because they're the ones that destroy the collagen and elastin fibers. UVB are shorter wavelength sun rays that don't go as deep. For the most part, it burns the top layer of skin, which is where all the skin cells, basal cells, squamous cell, melanocytes are sitting. And those are the ones that actually will produce skin cancer. The SPF number will indicate the sunscreen's effectiveness against UVB rays. And how much time you can get with the SPF level while swimming. Water resistant, 40 minutes. I think they took away the ability to put waterproof on the products now, so I think they label as water resistant 40 minutes and water resistant at 80 minutes. I think the ones that we have today on our display here are water resistant at 80 minutes. There will be a skin cancer or skin aging alert if you're buying a skin lotion product where the SPF is less than 15 and that the sunscreen is not broad spectrum. These products may help prevent sunburn, but will not help against skin cancer or early skin aging. Just a few comments about chemical versus physical sunscreen. The difference between the two sunscreens is that the chemical sunscreen is absorbed into the skin. It converts the UV rays into heat and disperses it. It's very thin, it's ideal for every use. It allows for skin care ingredients to be added easily. Physical skin screens will sit on top of the skin. It will reflect the UVA, UVB rays. It works immediately when applied, however, it is prone to wear off easily. Again, you can sort of see on the left is these chemical sunscreens where it will penetrate down to a deeper level where it will be absorbed and dispersed. It usually takes a little longer to be effective, up to 20 minutes. And there are some active ingredients in these chemicals, oxybenzone, which we will discuss in a few minutes. The physical sunscreens on the right will hit the skin surface and will reflect off it, so it does not penetrate. It works quickly, and the active ingredients of zinc oxide and titanium dioxide. There's been a little controversy now to the use of chemical sunscreens. Because of the fact that it is absorbed into the skin, there's been some studies that linked health issues from allergies to infertility. So therefore, there is a little controversy where now you should probably think twice of putting chemical sunblocks on children or expecting women. So studies have shown that regular sunscreen use will decrease the risk for squamous cell cancer as well as malignant melanoma. So in summary, you need to be active in your prevention of skin cancer by avoiding sun exposure during midday. You want to be investing into UPF sun protective clothing, and you want to be using large amounts of broad spectrum sunscreen. So now we've talked about preventing skin cancer, understanding what are the skin cancer types, what are the people at risk for skin cancer, early detection through early screening, which will lead us to ultimately early treatment, because that will get us the best results. I will just spend just a couple minutes about treatment. These procedures, people have heard of Mohs procedures, maybe a little less likely frozen section procedures. These are the standard of care for removal of skin cancers, particularly basal cell cancers and squamous cell carcinomas. In our centers, I've developed a modified version of a frozen section technique, which actually takes the techniques from both a frozen section and Mohs surgery. We've achieved about a 99% plus success rate when we remove these cancers. We are going to be publishing our database of over 1,600 cases consecutively using this technique with this success rate. We do the same thing. It's immediate analysis of the cancer under the microscope. These technique from the frozen section technique is used by either a plastic surgeon or general surgeon. Mohs surgery is usually performed by a dermatologist. The closure that's performed immediately after removal of the skin cancer by frozen section technique, performed again by the plastic surgeon or general surgeon. And the microscopic analysis is performed by a pathologist. This is done all at the same time. Our treatment time on the average is about under 1 hour per patient. And on a side note, it's interesting about the Mohs procedure, which is groundbreaking, is Dr. Frederick Mohs, who was a general surgeon, pioneered and developed the Mohs surgery technique while being a medical student in the research lab at the University of Wisconsin back in 1938. And again, if you look at the techniques between frozen section Mohs technique, this is a little more technical, but essentially what you're doing, you're on both sides, you're taking small slices. In the case of frozen section, you're taking small slices, but you're also incorporating the entire skin cancer. Where in a Mohs technique, you're taking slices, but you're really examining the edges to make sure all the cancer is gone. But both techniques have been shown to have a very high success rate. I think with Mohs technique, you hear about 98, 99%. Frozen section may be closer to 95%. But since I've adopted a modified technique and I use it exclusively for my patients, I've got my results up to 99% plus. So, in summary, how to prevent skin cancer? Protect from sun exposure. Detect, early detection, identifying patients who are at high risk. And once you get them detected, you do the biopsy, you want to treat, and you want to treat early, because that gives the best survival, particularly in our subset of patients who have melanoma. I would like to thank the Delaware Cancer Community Support Center for allowing me to speak on behalf of their community for Skin Cancer Awareness Month, which is the month of May. I also want to thank Mary Bruno from Moving for Melanoma to come to join us. We offer screenings throughout the entire state at our different sites in New York, Rowan Beach, and Dover. And again, I understand since this year is different, since we are now talking to a live audience, if there are any questions, we were happy to answer by phone, email. Just contact our staff at the Delaware Cancer Community Center or to the office at our phone numbers listed above. So thank you very much for your time, and I hope everybody has a healthy